In the blood-soaked forests of northern Georgia, on a September morning, when the fate of the American Republic hung in the balance, a musket ball fired by a Confederate soldier would begin one of the most extraordinary medical odysseys in military history. Private Jacob Miller of the 9th Indiana Infantry should have died instantly when the .58 caliber lead bullet punched through his forehead and burrowed deep into his brain tissue. Instead, he would live for 54 more years, carrying that piece of Confederate lead in his skull like a ticking time bomb, his mind slowly fragmenting as the metal poisoned his thoughts and transformed him from a gentle farmer into a stranger even his own family could barely recognize. This is the haunting story of a man who survived the impossible, only to discover that some wounds never heal. They simply change the way they kill you. The autumn of 1863 found the United States locked in the bloodiest conflict in its history, a civil war that had already claimed hundreds of thousands of lives and showed no signs of ending. The Battle of Chickamauga, fought in the dense forests and open fields of northwestern Georgia, would prove to be one of the war's most savage encounters. A two-day slaughter that left over 34,000 men dead, wounded, or missing from both armies combined. The battlefield itself was a nightmare landscape of smoke, screaming, and confusion. The thick woods of the Chickamauga Creek Valley, with their tangled undergrowth and limited visibility, turned what should have been organized military maneuvers into a series of desperate close-quarters firefights, where soldiers often couldn't see their enemies until they were close enough to touch. The acrid smoke from thousands of muskets hung in the humid September air like a poisonous fog, while the screams of wounded men echoed through the trees like the voices of the damned. Union and Confederate forces had been maneuvering for position since dawn on September 19th, each army seeking the advantage that would allow them to crush their opponents and potentially end the war. The 9th Indiana Infantry, part of General William Rosecrans's Army of the Cumberland, had been ordered to advance through a section of dense woodland known locally as the Brotherton Woods, where Confederate forces under General Braxton Bragg had established defensive positions among the trees and fallen logs. Private Jacob Miller, 24 years old and a veteran of 2 years of fighting, moved through the undergrowth with his regiment, his Springfield rifle loaded and ready, his heart pounding with the familiar mixture of fear and adrenaline that every soldier knew. He had enlisted in 1861 from his family's farm outside Lafayette, Indiana, driven by a sense of duty and the naive belief that the war would be over within a few months. Now, 2 years later, he had seen enough death and suffering to last several lifetimes, yet he continued to march forward because that was what soldiers did. They followed orders, even when those orders led them into hell. The morning had been relatively quiet, with only sporadic skirmishing between advance scouts. But as the 9th Indiana pushed deeper into the woods, the sound of musket fire began to intensify. Confederate sharpshooters, hidden behind trees and in hastily constructed earthworks, picked off Union soldiers with deadly precision, while return fire from the advancing Federal troops splintered bark and filled the air with flying wood chips and lead bullets. Jacob's company was advancing in a line formation, each man separated by several feet to minimize casualties from enemy fire, when they encountered a strong Confederate position near a small clearing in the woods. The enemy soldiers, members of the 1st Tennessee Infantry, had taken cover behind a fallen oak tree and were pouring devastating fire into the advancing Union ranks. Jacob's captain, a young officer from Indianapolis named Thomas Bradley, ordered his men to fix bayonets and charge the Confederate position, hoping that speed and aggression would overcome the enemy's defensive advantage. What followed was a scene of indescribable chaos and violence. Jacob found himself running through the smoke-filled woods, his bayonet-tipped rifle held at the ready, while Confederate bullets whistled past his head and struck down his comrades on either side. The distance to the enemy position seemed to stretch endlessly, each step taking him deeper into a maelstrom of gunfire and screaming that would haunt his dreams for the rest of his life. He was perhaps 30 yards from the Confederate line when the musket ball found him. The shot came from a young Tennessee soldier named William Hayes, barely 18 years old, who had been aiming at another Union soldier when Jacob suddenly appeared in his sights. Hayes pulled the trigger of his Enfield rifle without really thinking, the action as automatic as breathing after months of combat, and watched through the smoke as the Union soldier stumbled and fell. The .58 caliber Minié ball, a conical lead bullet designed to expand upon impact and cause maximum damage, struck Jacob just above his left eyebrow with tremendous force. The bullet, traveling at nearly 1,000 feet per second, punched through the frontal bone of his skull as if it were made of paper, creating a neat round hole approximately half an inch in diameter. The projectile then plowed through the frontal lobe of his brain, destroying tissue and blood vessels as it carved a path through the most complex organ in the human body. By all rights, Jacob Miller should have died instantly. The frontal lobe controls personality, decision-making, and motor function, and the massive trauma inflicted by the musket ball should have caused immediate death or, at minimum, permanent unconsciousness. Instead, Jacob experienced what he would later describe as a brief moment of brilliant white light, followed by a sensation of falling through space before everything went black. When Jacob regained consciousness several hours later, the battle had moved on, leaving him lying among the dead and wounded in a forest clearing that had been transformed into a charnel house. Bodies lay scattered among the trees, some still moving and moaning, others already beginning to stiffen in the afternoon heat. The metallic smell of blood mixed with the acrid odor of gunpowder and the sickly sweet stench of death that would become permanently associated with Civil War battlefields. Jacob's first sensation upon awakening was a throbbing pain in his head, unlike anything he had ever experienced. When he reached up to touch his forehead, his fingers came away covered with blood that was still seeping from the entry wound. Remarkably, however, he found that he could think clearly and move all his limbs, though his left eye was swollen shut and his vision was blurred. The discovery that he was still alive came as a shock to Jacob, who had a clear memory of being shot and falling to the ground. He had expected to die on that battlefield, as so many of his friends had already done, and the realization that he had somehow survived filled him with a mixture of gratitude and confusion. He could feel something wrong inside his head, a pressure and a strange sensation of movement that he couldn't quite identify, but he was alive, conscious, and apparently capable of walking. Jacob's journey from the battlefield to medical care was an ordeal that would have tested the limits of human endurance, even for an uninjured man. The nearest Union Field Hospital was located 3 miles away, in a farmhouse that had been commandeered by military surgeons to treat the flood of casualties from the battle. Jacob walked that entire distance, stumbling through the darkening woods with blood streaming down his face, guided only by the distant sounds of voices and the flickering light of lanterns. The field hospital was a scene of organized chaos, with wounded soldiers lying on every available surface, while overworked surgeons performed amputations and other emergency procedures by lamplight. The farmhouse's parlor had been converted into an operating room, its furniture pushed aside to make room for wooden tables where surgeons worked with blood-stained instruments, while the kitchen served as a recovery area for patients who had survived their operations. When Jacob staggered into the hospital, supported by 2 other wounded soldiers he had encountered on the road, the medical staff initially assumed he was suffering from a minor head wound that looked worse than it actually was. Head wounds, they knew, bled profusely even when they were superficial, and Jacob's ability to walk and speak coherently suggested that his injury was not life-threatening. Dr. Samuel Harrison, a surgeon from Ohio who had been working without rest for 18 hours, conducted the initial examination of Jacob's wound. Using a small mirror to reflect lamplight into the entry hole, Dr. Harrison was astonished to discover that the bullet had penetrated completely through the skull and into the brain tissue. The fact that Jacob was conscious and coherent with such a massive head injury defied everything the surgeon had learned during his medical training. Dr. Harrison called for his colleague, Dr. Marcus Webb, a more experienced surgeon who had served in the Mexican-American War and had seen his share of unusual battlefield injuries. Together, the two physicians conducted a more thorough examination, using primitive probes to explore the wound track and determine the extent of the damage. Their investigation revealed that the musket ball had lodged deep within Jacob's frontal lobe, where it remained embedded in brain tissue that was already beginning to swell from the trauma. The surgical options available to Civil War physicians were severely limited by the primitive state of medical knowledge and the lack of proper instruments and facilities. Brain surgery was virtually unknown in 1863, and the few attempts that had been made to remove foreign objects from the brain had resulted in immediate death from infection or hemorrhage. Dr. Harrison and Dr. Webb faced an agonizing decision: attempt to remove the bullet and almost certainly kill their patient, or leave it in place and hope that Jacob could somehow survive with a piece of lead permanently embedded in his brain. After consulting with the hospital's chief surgeon, Dr. Jonathan Mitchell, the medical team decided that any attempt to extract the musket ball would be fatal. The bullet had penetrated too deeply into vital brain tissue, and the surgical techniques of the era were simply inadequate for such a delicate procedure. Instead, they would clean the wound as thoroughly as possible, treat it with carbolic acid to prevent infection, and hope that Jacob's remarkable constitution would allow him to survive with the foreign object in place. The treatment Jacob received was typical of Civil War battlefield medicine. The wound was irrigated with water to remove debris and blood clots, then treated with a carbolic acid solution that was thought to prevent infection. The entry hole was packed with lint bandages soaked in the same antiseptic solution, and Jacob's head was wrapped in clean linen to protect the wound from further contamination. Dr. Harrison documented Jacob's case in detail, recognizing that he was witnessing something unprecedented in military medicine. The surgeon's notes, preserved in the National Archives, describe a patient who should have been dead, but instead remained conscious, coherent, and apparently capable of recovery, despite carrying a musket ball in his brain. The case would eventually be studied by military physicians throughout the war and beyond, as doctors struggled to understand how such a severe injury could be survivable. Jacob's recovery at the field hospital was remarkable by any standard. Within days of his injury, he was walking around the hospital grounds, helping to care for other wounded soldiers and showing no obvious signs of neurological damage. His left eye remained swollen and his vision was permanently impaired, but his speech was clear, his memory intact, and his personality unchanged from what his fellow soldiers remembered. After 2 weeks of observation, Jacob was transferred to a larger military hospital in Nashville, where he underwent more extensive medical evaluation. The physicians there were equally amazed by his condition and conducted numerous tests to assess his neurological function. They found that while Jacob had some weakness on his right side and occasional headaches, he was otherwise remarkably normal for a man with a bullet in his brain. The decision to discharge Jacob from military service was made reluctantly by Army physicians who recognized that he could no longer serve effectively as a combat soldier, but who were also fascinated by his unique medical condition. He was granted a disability pension and sent home to Indiana, where he would spend the rest of his life as a living medical curiosity and a testament to the human body's extraordinary capacity for survival. Jacob's return to civilian life in Indiana was initially successful, though marked by subtle changes that would become more pronounced over time. He married his childhood sweetheart, Mary Elizabeth Thompson, in 1865, and together they established a small farm outside Lafayette where they raised corn and livestock. Jacob proved to be a capable farmer and a devoted husband, though Mary noticed that he sometimes suffered from severe headaches and occasional episodes of confusion that seemed to come without warning. The couple's first child, a son named Thomas, was born in 1867, followed by daughters Sarah and Rebecca in 1869 and 1872, respectively. Jacob was a loving father who delighted in his children and worked hard to provide for his growing family. However, as the years passed, Mary began to notice disturbing changes in her husband's personality and behavior that seemed to be getting worse rather than better. The first major symptom to appear was epileptic seizures, which began occurring with increasing frequency in the early 1870s. These episodes, which Jacob called his spells, would begin with a strange metallic taste in his mouth and a feeling of dread, followed by violent convulsions that left him unconscious for several minutes. The seizures were terrifying for his family to witness and left Jacob exhausted and confused for hours afterward. More troubling were the gradual changes in Jacob's personality that became apparent as the 1870s progressed. The gentle, even-tempered man that Mary had married was slowly being replaced by someone who was increasingly irritable, impulsive, and prone to violent outbursts over trivial matters. Jacob himself was aware of these changes and was deeply distressed by his inability to control his emotions and behavior. The lead bullet in Jacob's brain was slowly poisoning him, leaching toxic metals into his brain tissue and causing progressive damage to the neurons that controlled his personality and cognitive function. Lead poisoning, or plumbism, was poorly understood in the 19th century, but modern medical science recognizes it as a serious condition that can cause neurological symptoms, including seizures, personality changes, and cognitive decline. As the 1880s began, Jacob's condition had deteriorated to the point where he could no longer work effectively as a farmer. His seizures had become more frequent and severe, sometimes occurring several times per week, and his personality changes had made him increasingly difficult to live with. Mary found herself caring for a man who looked like her husband, but often acted like a stranger, someone whose moods could shift from gentle affection to violent rage without warning. The family's financial situation became increasingly precarious as Jacob's ability to work declined. Mary took in sewing and laundry to supplement their income, while their children helped with farm chores and took on part-time jobs to help support the household. The community rallied around the Miller family, recognizing that Jacob's condition was the result of his military service and that he deserved support and care. Jacob's case had attracted the attention of military physicians and medical researchers who were interested in studying the long-term effects of battlefield injuries. Beginning in the 1880s, he was regularly photographed and examined by doctors from the Army Medical Museum, who documented the progression of his symptoms and the gradual changes in his appearance and behavior. These medical examinations revealed that the bullet in Jacob's brain had shifted slightly over the years, migrating through brain tissue and creating new areas of damage as it moved. X-ray technology, which became available in the 1890s, allowed physicians to track the bullet's position and observe how it had carved a trail of scar tissue through Jacob's frontal lobe. The photographs taken of Jacob over the decades provide a haunting visual record of his decline. Early images from the 1870s show a man who appears relatively normal, despite the obvious scar on his forehead. Later photographs reveal the progressive effects of lead poisoning and brain damage. His face becomes increasingly gaunt, his expression more vacant, and his posture more stooped as the years pass. By the 1890s, Jacob's cognitive decline had become severe enough that he required constant supervision. His memory was failing, his speech was becoming slurred and difficult to understand, and he frequently became confused about where he was or what year it was. Mary, now in her 50s and worn down by decades of caring for her increasingly disabled husband, struggled to maintain their household while dealing with Jacob's unpredictable behavior. The seizures that had plagued Jacob for decades were becoming more frequent and more severe, sometimes lasting for several minutes and leaving him unconscious for hours. During these episodes, his family could only watch helplessly as his body convulsed violently, knowing that each seizure was causing additional damage to his already compromised brain. Despite his deteriorating condition, Jacob retained some awareness of his situation and was often lucid enough to express frustration and sadness about what he had become. He spoke frequently about the Battle of Chickamauga and the moment when he was shot, as if that September day in 1863 had become the defining event of his existence. He would sometimes tell visitors that he should have died on that battlefield with his comrades, and that living with the bullet in his head was a form of prolonged torture. The turn of the 20th century brought new medical advances that allowed physicians to better understand Jacob's condition, but offered little in the way of treatment. Neurosurgery was still in its infancy, and the techniques required to safely remove a bullet from deep brain tissue would not be developed for several more decades. Jacob remained a medical curiosity, a living example of the human body's ability to adapt to severe trauma, but also a tragic illustration of the long-term consequences of battlefield injuries. As Jacob entered his 70s, his condition stabilized somewhat, though at a level of severe disability that required full-time care. His seizures continued but became less frequent, and while his cognitive abilities remained severely impaired, he seemed to find some peace in the routine of daily care provided by his family. Mary, now elderly herself, was assisted by their children and grandchildren in caring for Jacob, who had become a gentle but confused old man who bore little resemblance to the vigorous young soldier who had charged through the woods at Chickamauga. The medical community continued to follow Jacob's case with interest, and he became something of a celebrity among physicians who specialized in neurological disorders. Articles about his condition appeared in medical journals, and he was featured in textbooks as an example of the brain's remarkable ability to compensate for severe injury. However, these scientific achievements came at an enormous personal cost to Jacob and his family, who had sacrificed decades of normal life to the bullet that refused to kill him quickly. World War I brought renewed interest in Jacob's case as military physicians dealing with a new generation of head injuries sought to understand the long-term prognosis for soldiers who survived severe brain trauma. Jacob, now in his late 70s, was examined by army doctors who were amazed that he had survived for over 50 years with a bullet in his brain. His case provided valuable insights into the treatment of similar injuries sustained by soldiers in the trenches of France and Belgium. Jacob Miller died peacefully in his sleep on January 15, 1917, at the age of 88, 54 years after a Confederate musket ball should have ended his life on a Georgia battlefield. His death came as a relief to his family, who had watched him suffer for decades with the progressive effects of lead poisoning and brain damage. Mary, who had cared for him devotedly for over 50 years, was at his bedside when he passed away. The autopsy performed on Jacob's body was conducted by Dr. William Thompson, a neurologist from Indiana University who had been following his case for several years. The examination revealed the full extent of the damage caused by the musket ball, which had migrated approximately 2 inches from its original position and had carved a trail of scar tissue through Jacob's frontal lobe. The bullet itself, when finally removed from Jacob's brain, was found to be severely corroded by decades of exposure to body fluids. The lead had leached into surrounding brain tissue, creating areas of discoloration and damage that explained many of Jacob's neurological symptoms. The autopsy findings were published in several medical journals and contributed to the growing understanding of lead poisoning and its effects on the nervous system. Dr. Thompson's examination also revealed that Jacob's brain had developed remarkable compensatory mechanisms to work around the damaged areas. New neural pathways had formed to bypass the scar tissue, and undamaged portions of his brain had taken over functions that were normally handled by the destroyed tissue. This neuroplasticity explained how Jacob had been able to function for so many years, despite such severe brain damage. The preserved bullet and sections of Jacob's brain became part of the medical collection at Indiana University, where they were studied by researchers for decades. The case contributed significantly to the understanding of penetrating head injuries and helped establish protocols for treating similar wounds in future conflicts. Jacob's military records were updated to reflect his extraordinary survival, and he was posthumously recognized as one of the longest surviving victims of a penetrating head injury in military history. His case became a standard reference in medical textbooks and was cited in numerous research papers on traumatic brain injury and lead poisoning. Modern neurosurgeons who have studied Jacob's case recognize that his survival was due to several factors that aligned in his favor. The bullet entered his brain at a relatively low velocity compared to modern projectiles. It missed critical blood vessels and brain structures, and his young age at the time of injury allowed his brain to adapt more effectively to the damage. However, they also acknowledged that his long-term suffering was largely preventable with modern medical techniques. Contemporary treatment of similar injuries would involve immediate surgical removal of the foreign object, aggressive treatment to prevent infection and swelling, and comprehensive rehabilitation to help the patient recover lost functions. The lead poisoning that caused so much of Jacob's suffering could have been prevented by removing the bullet soon after the injury, rather than leaving it in place for decades. Jacob's case also highlights the inadequate support systems available to disabled veterans in the 19th and early 20th centuries. While he received a small disability pension, his family bore the primary burden of caring for him throughout his long decline. Modern veterans with similar injuries would have access to comprehensive medical care, rehabilitation services, and family support programs that were unimaginable in Jacob's era. The psychological impact of Jacob's condition on his family was enormous and largely unrecognized by the medical establishment of his time. Mary Miller spent over 50 years caring for a husband whose personality had been fundamentally altered by his brain injury, watching helplessly as the man she married gradually disappeared behind the effects of lead poisoning and neurological damage. Their children grew up with a father who was physically present but emotionally and cognitively compromised, creating family dynamics that were both challenging and heartbreaking. Jacob Miller's extraordinary case reminds us that survival is not always a blessing, and that some wounds continue to inflict damage long after the battles that caused them have ended. His story stands as a testament to the human capacity for endurance in the face of unimaginable adversity, while also serving as a sobering reminder of the true cost of war, not just in lives lost, but in lives forever changed by trauma and injury. The soldier who carried a Confederate bullet in his brain for 54 years teaches us that the battlefield extends far beyond the moment of combat, and that some veterans fight their wars for decades after the shooting stops. In the archives of military medicine, his case remains a landmark in the understanding of traumatic brain injury, a reminder that medicine's greatest challenges often come from the courage to keep living when death might have been a mercy. Next time, we'll explore a case that challenged Victorian understanding of human anatomy, a woman whose condition would force physicians to reconsider everything they thought they knew about the limits of human survival and the body's capacity for adaptation. If you found Jacob's journey as compelling as I did, consider subscribing to witness more extraordinary cases from medicine's most mysterious chapters. Each week, we delve deeper into the archives where human resilience meets medical impossibility, where survival becomes its own form of suffering, and where the past reveals the true cost of courage. Until then, remember that within each of us lies the potential for extraordinary endurance, sometimes beautiful, sometimes tragic, but always profoundly human in its complexity and mystery.